Welcome to the Stress-Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches, or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode. And I am super excited to introduce my next guest, Dr. Ervin Weiss. He's the CEO of Nobio, and he is zooming in from Tel Aviv, Israel. It's about 7 o'clock at night there. And thank you so much for joining us.
Thank you. Thank you for inviting me. Thank you very much.
I want to get into all of the cutting edge and the technology and the antibacterial Infinix restorative system that you have for caries and all the other things that you're doing to help dentistry. But first, I'd just love to hear your story about how you became a dentist and what dentistry is like in Israel.
For me, it was very natural to become a dentist. My father was a dentist, and I grew up in a house where the practice was at home, and all what I saw as a child and as a young adult is a dentist and dental work. So it was very natural for me. I entered dental school at the age of 18, and the rest is history. Basically, my parents were very, second generation of Holocaust, and they were very highly protective. So they took care of everything, and they were very, very supportive. About dentistry in Israel, dentistry is a very interesting profession. Along my career, I was the dean of the dental school in Tel Aviv University, and I traveled a lot, visiting a lot of dental schools in Europe and United States. And I found something very interesting. Dentistry is very similar everywhere. And it's amazing. And the people who are in this profession have the same mentality, the same way of thinking, same issues, same problems, same difficulties, same challenges. So it's no different than other system, and if a dentist comes from the States to practice in Israel, you find everything. The materials the same, equipment the same, the treatments are very similar, and global village.
It's amazing how we live these parallel lives as dentists, and I just used to think it was just the United States and maybe Canada, but it's all over the world, like you said. Now, are you safe where you are? Are you, what's this, the situation like there right now?
Oh, it is safe. It was safe all last few months. Although it's, with the CNN, you open it, it looks terrible, and it is terrible in some parts, but basically in Tel Aviv, in the major cities of Israel, life continues as always, and we don't feel anything threatened. With the exception of once in a while, mainly during night, we have a missile fired from Yemen or from Iran or from Iraq, and then we have to have the siren and we go to the shelter. But otherwise, we are okay.
Great. Good. Glad to hear that. And now, did you do dental school in Israel?
I graduated in Hadassah Medical Center in Jerusalem. And there are only two dental schools in Israel, in Hadassah and in Tel Aviv University. So I was joined Tel Aviv University immediately afterwards. I finished my service in the army, and since day one, I was full-timer in Tel Aviv University, and then I moved to Hadassah as head of department of prosthodontics. And then I came back to Tel Aviv to become the dean of Tel Aviv University. So all my career was in the dental school and teaching and doing research.
Tell me about your military service. That was right after dental school. How many years did you serve? And what was that like? What did that teach you?
I have excellent memories from my military service. That was my first patients in my career were soldiers. And when you are far away in a remote base, you are there in the desert, you, the patients, and God. Nobody can help you. So basically, it's the first day I remember my first day in the practice there. I opened the door, 8 o'clock in the morning, 30 patients waiting for me. Right immediately after finishing dental school, no senior dentist next to you to ask and to help and to give advice, bad communication. So basically, that was the best period of my professional life. I learned so much from that period, and mainly because I was not afraid of trying things and fail. Mm-hmm. And once you fail, you should be looking at this as a failure as a unique opportunity to learn. And there is no better teacher for you as yourself when you observe or you own work, follow up, and look how you can improve it. And every single day, you can do things better than yesterday. That's my lesson.
That's amazing. Yeah, you had 5 years of just a constant flow of patients, and you probably learned so much. And here in the States, it's similar after dental school. Unless you go on and specialize or do a residency, you're pretty much on your own. There's no more teacher to help you. And I felt the exact same way that you did. Now, tell me about. Let's get into Nobio and your product, Infinix.
Yes, that was a dream I started to dream of many years ago, realizing basically two different things. Number one is that we are doing so many procedures in the oral cavity of our patients, trying to cope with disease, trying to restore decayed teeth, and finally, all what you are doing is removing the infected tissue, and you're just fixing it with some material which has no activity, has no repair, no ability to cope with the etiology of the disease, no activity in order to give health or promote health. So I realized that's not the right thing to do, and I was looking for things to improve. So the first thing that struck me even stronger than that is the beginning of the fading out of amalgam, because amalgam was a restoration of choice in the posterior dentition, and it was very good. I mean, you can see still today amalgam restorations 30, 40 years in the mouth of patients without any decay. And I cannot say that about composites. It's very rare to see a very long-lasting composite restoration. So that's where I initially started to think about how to improve the composites. And we did lots of things we tried at the beginning. And I would say that the first, breakthrough in the concept was me inventing a test, a direct contact test, to see whether we can find a solid surface that is antibacterial. And after we invented the test, and I published it maybe in 15, 20 publications, starting in the mid-90s, and once this test is a direct contact test, what is amazing about the test that I used it to screen every single dental material that is on the market, available, and you can find it in a dental office. And you know what? Zero. No one single dental material has antibacterial property as a solid surface. And then I realized also the second thing was that it had a small exception maybe. The only exception we had a little bit of antibacterial activity with glass ionomer, and a little bit of antibacterial activity with amalgam. And both of them are much better than anything else. But if you look at how long it lasts, it fades away in weeks, several weeks, and no. But then we also realized that taking the composite as is and mixing into it various minor components, minor fillers that are solid, insoluble, we were able to screen hundreds of variants until we got to this formulation that works. And that's really unique because we add 1.5% of a specific filler, the silica filler, that we synthesize from scratch in the laboratory. And we add it during the production, manufacturing of the composite, we add it to the mixture. And once this composite, whether it's a flowable composite or a packable composite, once you photopolymerize it, it gets the same properties of any other composite on the market, with one tremendous exception. No bacteria can survive on the surface. And we have published it in several publications. The most amazing thing is an electron microscopic depiction of a regular composite. When you place on the top of it strep mutant cells, like we placed in this specific figure, 10 to the 6, more than 1 million live strep mutant cells. And on a regular composite, 24 hours later, you get a beautiful biofilm growing on the surface. Whereas on the Infinix surface, doing the same thing, the same time, nothing grew. All what's left is a little bit of debris of cell walls. And we did this experiment recently in Tel Aviv University about half a year ago by a dental student. We took whole plaque bacteria. I mean whole plaque, I mean saliva bacteria, because saliva, as you know, is sterile when it's secreted, and all what's in the bacteria in the saliva is shedding out from the dental plaque of the oral cavity. And usually they have about 10 to the 8 live bacteria in every ml of saliva. So we took these saliva samples and we did it for maybe 35 patients. Every single one, when you place it on a composite, you get beautiful growth of biofilm. 24 hours later, on Infinix, nothing grows. And this was published in the recent publication in JPD, Journal of Prosthetic Dentistry, in November, I think November 23. Yeah, November 23. And what's interesting about this also, we challenged this bacteria on the surface of composite with sugar, just to see whether there is a drop of pH, whether the bacteria can produce acid. And guess what? pH on Infinix remain above 6.5, whereas the pH of a regular composite dropped below 4.5. So it's really a dramatic effect. It's like 0 and 1. The effect is really dramatic. And it's not only our studies. It was a study performed in UCSF, San Francisco. They made they have a model of placing pieces of enamel from the same tooth, split in two pieces, into a removable partial denture, a lower removable partial denture. And then they create a gap, a standardized gap, 37 micron gap, and they place against the enamel a composite. One side is a regular composite used by the dental students in the clinic of some UCSF, and the other side, the Infinix. And then after 30 days, they remove it, and they looked at the gap at the enamel in the interface. And every single patient, they have demineralization on the enamel of the composite is controlled, and on the other side, it was far less. And in some instances, they had even remineralization. And basically, when you do statistics, you know, any in vivo experiment with people, you do statistics, it's very rare to get highly significant results. Here's a result where the P was smaller than 0.0001, highly significant. So basically, that study was independently done in USA, and it really tells you that it's not only killing bacteria, but actually it prevents demineralization. And based on that study, we got an FDA clearance for the product in the USA, and they allowed the claim that this product reduces demineralization, which is a critical part of the caries process. So as far as I know, that's the only product in the dental space that has a claim from FDA that actually copes with the disease, have any kind of effect on the recurrent decay and the longevity of restorations. So that's a very, very important milestone in the company. And as I told you, we are using in my office in Tel Aviv. We are 4 dentists working, and we are using Infinix constantly in the last 3 years. Excellent results. Excellent results. And you know what? In a way, that's a dream of any doctor who does composites, because everybody, some of the patients are doing fine, no problem. You place in a composite and it's gone. But every single dentist has that frustration that you call for the patient for a recall a year later, 2 years later, 3 years later, and you see the decay, you see the problems. So I really think it's a revolution in our profession. I don't know how a good future is going to look like, but definitely more and more products like that are going to be in the market.
You sent me an image here, which we'll share once the podcast airs, but it's an SEM image of the plaque bacteria on composite resin, and the traditional resin, it looks like it has, billions of bacteria on it. And then the Infinix looks just like it's totally clean, except for some random, small cells here and there, but it's just, completely different than the traditional composite.
The random cells, you see, they are ghosts of bacteria. We know for sure because nothing grows on it. Because you add growth media and you want to see which of the bacteria are alive on this surface, nothing is alive. So basically,
I was going to mention, you mentioned earlier that you said most of the materials out there, other than amalgam and some glass ionomers, do have some antibacterial processes, but it doesn't last long, and most of, or if not all of your standard composites are totally inert and have no antibacterial processes to them.
Yeah, not only that. We published a couple of studies in the past. Some patients have bacteria that grow even better on composite. And I think clinical observation, if you are very meticulous, you look into some of the patients, you see that the composite in some patients accumulate more plaque bacteria than the tooth itself or any other restoration. Not all of them, some patients. And we did some other experiments just to show how long-lasting is the effect of Infinix. And we have published also a publication in Journal of Dentistry. At least 6 months later, we could retrieve plaque bacteria from the surface of the composite, from the oral cavity, and showing that it's very effective even 6 months later. So I don't know how many months or how many years later it's still going to be active, but for sure it's a lasting effect. And I would emphasize here, the most important thing here is that nothing is released from Infinix. Nothing is released. So just to compare it with some bioactive, so-called bioactive composites on the market, they do release ions of fluoride, of calcium, of phosphate, and whenever they release something is missing from the mass. And this effect is good for several weeks, maybe several months. but it has to compromise the composite itself, and then the effect is not so lasting. But still, they have some beneficial effect, especially if you do it underneath, like a liner, directly on the dentin. But as a composite, as a restorative, I don't think it's going to be so effective. Here we have a composite which is effective, and in our system we have a packable composite, we have flowable composite, we have bulk fill, a flowable composite, Infinix, and a two-bottle system for bonding. The primer and a bonding that the system contains also the antibacterial particles, antibacterial effect.
Actually, I have them right here. You have the bonding, you have the primer and the bond, and then there's a bulk flow and a regular flow, and then there's some packable material. Is there a special technique that goes along with this? Personally, I don't do much etching anymore. I do occasionally for some anterior work, but for my typical posterior fillings, class 1s, class 2s, buccal, class 5s, I don't do any etching. Is this something you can do without etching?
Yeah, definitely. The primer of this product is a self-etch primer, and you have to rub it in for 25 to 30 seconds if you don't use etching at all, and it binds very, very nicely to dentin and to enamel. And we recommend to do that because it's really not only saving the etching time, but also it doesn't cause bleeding. Sometimes the etching, you etch and you cause some bleeding, and you're difficult to control the surface. And it's very nice. The only thing that I do differently, maybe, I don't know, it's also based on some publication we did several years ago. After finishing the restoration, when the restoration is finished, polished, occlusal adjustment, everything, I do rebonding. It's a habit I have for many, many years, and don't really ask me why, but I feel much better if I do rebonding and photopolymerize it again, even if I don't see anything with my magnifying glasses. You know, it shrinks. When it shrinks, it has some micro gaps somewhere around the interface between the tooth and the restoration, and I just want to make sure that I can improve it somehow by making rebonding at the end of the procedure. But that's me.
It looks like for me it would be a primer, scrubbing for 20 seconds. No need to air dry.
You want to air dry the primer. Air dry. Yes.
And same with the bond after you put it on, like your
gentle air dry.
Yeah.
Just to spread it to a thin layer. That's all. And the values of the bonding strengths are really about 20 megapascal. It's really very nice.
Now, I have maybe totally have missed this during this conversation. Can you explain to the audience what is the technology behind Infinix?
The technology is a filler. We have invented a filler that actually we manufacture, we synthesize from scratch in the laboratory, in the Nobio laboratories. And the filler is a silica filler. It's nano-size filler, anything between 30 nanometer up to 150 nanometer. We control the size of it. Once we synthesize the filler, the silica, we decorate it with some quaternary ammonium compounds, which are covalently bound to the surface of the filler. So that's the whole trick here. We covalently bind quaternary ammonium to the silica particle. It sounds very obvious and very easy. It's not. We have 7 families of patents around this technology. And the trick here is to bind many quaternary ammonium residues to the surface. And we add at the end, we mix it to the final product during manufacturing, no more than 1.5% of the filler. So 98.5 of the filler is regular filler at any other composite. And that's enough to have only 1.5% of the filler, this specific filler, and it give you saw the SEM pictures, tremendous effect. And of course, it goes without saying, otherwise we wouldn't be able to get the FDA clearance. We went through all the safety and all the efficacy testing and biocompatibility and tissue culture and animal experiments that's required by the FDA.
Now, can it be used on any patient? For example, I'm just thinking about patients that come in and they're just, have dry mouth because of some of the medications they're on. Can it really be used in any situation?
Yeah, it is a very, very interesting question because the biggest interest here in Israel we got from the dentists who are dealing with what we call oral medicine. So they treat these patients which are really very difficult to treat because they have dry mouth, as you mentioned. Dry mouth is either by medication, by disease like Sjögren, or with age. What happens is the dry mouth is part of the problem. And this specific group of dentists in Israel who are treating this category of patients only, they are running after me to get the material because they don't have any other material. Unless you use glass ionomer, and it's more like transitional material. It's not really last for the restoration. And they report very good experiment. And you know what? For my personal experience, and I got it from the colleagues, pediatric dentistry, who are treating children in general anesthesia, like 3 or 4 years old. You cannot treat them. And they have rampant caries, some of them. You don't want to use a regular composite. And I've learned 2 things, what's happening here. Number 1, they do much more extraction than used to be in the era of amalgam, because amalgam is not allowed to be used in children. And they use much more crowns, prefabricated crowns, because they don't trust the composite.
Right.
And if a composite failed in a child who is 3 years old, a year later, you have to make another general anesthesia. So that niche is really highly demanding for this kind of solution.
That's great. I didn't even think about that, but for pediatrics. Now, where can Infinix be purchased?
In the States, it can be purchased through Ditron Dental USA. Ditron Dental is a company who is distributing dental implants. But now we have a joint agreement with them, and they are going to distribute innovative dental materials. And we find them very, very enthusiastic in this collaboration. And you can either contact one of their distributors or go direct online, shop, and you find the Infinix product there, and you can just order it online.
And the future of Nobio and Infinix, I don't know if you can talk about it, but it seems like what you're doing would go great with root canals, with implants, with other materials, cements, bone graft. Like what's on the future horizon for Nobio and for Infinix?
Yeah, actually, you are just entering an open door here, because we are now in the company. You're doing experiments, proofs of concept, and we have also already prototypes for root canal sealer. And we are going to go to the traditional, very well documented root canal sealers, epoxy-based. We're developing a sealant for root surface desensitization. And we are developing now a product for 3D printing in dentistry. There are now trends of 3D printing of crowns and dentures. And we have now a product that is compatible with it. And of course, we have an open project doing coating of dental implants and implant prosthetic parts, which is going to improve dramatically the soft tissue reaction with implant dentistry.
That's amazing.
Let me just add it. It's only
Sure.
the case because this platform has application as a medical device.
Mm-hmm.
Just published a publication recently. We have developed a silicon, implantable medical grade silicon that is antibacterial. And it's really promising to go into this space too in the future.
Yeah, personally, as I mentioned when we were talking, I personally went through, a tremendous amount of burnout, but I found, I love dentistry again because I just love the technology and the new techniques and treatments that are out there. So I absolutely love what you're doing. And I wanted to just finish off with two final questions. Number one is, how do we find out more about Infinix and Nobio? And the second question is, what advice would you give to the young dentists out there?
Yeah. About Infinix, I mean, all what you have to do is punch my last name, first name. You get about 30, 40 publications about that. If you are really looking into the company and want to learn more about the evidence that we have clinically and in vitro. Otherwise, you can visit the website of infinix.com and you can find out more about the materials and more about the future plans of the company. And about your other question, what advice I can give young dentists? I was teaching a lot, many, many years. I was teaching for many years dental students. And as the head of department, as a dean, I used to come into the class of the final year before they go out for their private practices and learning from the real world dentistry. And I used to tell them, there are three things I cannot teach you. Number one, I cannot teach you motivation. If you are not having that internal drive of being motivated to learn more, you have to do it by yourself. The other thing I cannot teach you is experience. You have to make your own mistakes in order to learn. And the third advice, I would say, do your mistakes, but do not make the same mistake twice. Learn from all your mistakes every single day. You can improve yourself through the rest of your professional life.
That's great. Love it. And Dr. Ervin Weiss, CEO of Nobio, and check out infinix.com or on the Ditron website. Thank you so much for joining us. Such a great episode.